Well, joining us now is urologist Dr. Gil Brito with Honor Health. Thank you so much for coming in. We just heard one of the doctors in that piece explaining about this aggressive form of prostate cancer, that it is no longer curable, but treatable. Explain that.
Well, prostate cancer is highly curable if it's found early. His is advanced. When it's spread to the bones, that's about as more advanced as you can get.
Right.
So it's not considered curable, but there's a lot of new things going on, a lot of research at different institutes, Honor Health, different places where there's new treatments now that can actually change this from a lethal disease to a chronic condition.
Right.
So he may be on treatments for a while.
And what kind of treatments would this consist of?
Well, the first thing is we call it androgen deprivation therapy, which is a fancy way of turning off testosterone production.
Oh.
Obviously, a lot of side effects to that, but prostate cancer cells need testosterone, so that can put it in remission. And now we have found other drugs that can be added to that, and sometimes in certain conditions, chemotherapy, but it's kind of personalized health, doing different things to try to control the disease.
So what's the prognosis?
Well, if you look at it, it's not good. But today, he's very fortunate. I mean, within just 2 years, it's dramatically changed. You know, he could have 5 years or more, but he'll have to go on different treatments.
You know, he's 82 years old. Did age have anything, was that a factor in any of this at all?
Well, the reality is almost 80% of 80-year-olds may have a focus of prostate cancer, but it's not really anything significant, so we really don't usually look for it. But sometimes even an 80-year-old can have something that's much more aggressive. And so I think he went in complaining of some urinary symptoms.
Right.
And I think he had an exam, and that's maybe where they found it.
Okay, so that was my next question. He complained about having those urinary symptoms, and then they found a small nodule. So can you talk in general just about what kind of symptoms should men be looking for?
Well, we all, as we get older, our prostate gets enlarged, and it starts to change how you urinate. The flow may not be as strong. You may have to get up at night. When you used to be able to think about going later, you better go sooner.
Right.
You know, it's a little urgent. But that happens with benign disease, not just prostate cancer.
Okay.
You know, so that's why prostate cancer, you should be really screening for it, you know, not waiting for symptoms. Because if you have symptoms from prostate cancer, that is a sign that it's advanced.
Yeah, and it's too late. So that was my next question. You know, a lot of times, obviously for women, you know, they advise getting screened, having your mammogram. For men, is this something that they should be doing annually, or, you know, what should men be doing?
Well, it's controversial. If you ask a urologist, yes, you should be. And we're the ones treating it. But for a while, that was standard. You know, PSA and a physical exam called a prostate exam. And then there were some studies and government regulations saying that we shouldn't be doing that. And all of a sudden, people were showing up with advanced disease. And now we're saying, no, you need to start getting checked. And finally, it's getting better.
Okay.
But the really scary thing is a lot of times primary care doctors are told that they don't need to do an exam. And that's not true. There's a significant percent of patients who have a normal blood test PSA
Right.
and an abnormal exam, and we find it, and often they tend to be more aggressive.
Okay, so is there an age that, you know?
I think it's starting at age 50, but if you have a family history,
Right.
we have 40-year-olds getting checked.
Sure. All right. Thank you so much, Dr. Brito, for great insight. We appreciate your time.
Well, thank you. Appreciate it.